digital transformation. This a brainstorming topic nowadays. I am Dr. Tariq Study. I started my career with general procedure, and during that time, I kept searching for a new devices to minimize my failure first of all, and also to enhance my patient experience. The first transformation for me was the digital X-ray, and then the apex locator, rotary system, obturation system, and then the single tooth anesthesia system, bleaching, laser machine, extraction machine, sedation. But my transformation began on 2013 when I attended Dr. Koshman Digital Smile Design course in Romania, and then I add my camera and the studio setup. But my huge evolution was in 2015 when I owned my intraoral scan, and then I added the microscope to improve my preparation, and the milling machine, ceramic milling machine, to save my time, the 3D printer to speed up my mockups, BRF machine, zirconia milling machine, furnaces, and then recently the 3D face scan, CBCT machine, soft and hard tissue laser, and my stern Whipper rotation dental unit. So technology plays an essential role in our evolution. Digital dentistry, not the future anymore, it's the present. The first step in this evolution is the strategic plan. You need to establish a direction of your practice by assessing both where you are and where you are going. Set up your plans to reach your goals. To have a plan, you need to answer these questions. Start, think, act, and communicate with yourself, with your colleagues, and with the decision makers. Find an answers. Why you need digital transformation, the purpose, what will motivate you to take an action, what are the parameters you will rely on to take an action, what do you need, what are the criteria of your digital transformation selection, when, and once you have a clear answer for why and what, then you can decide the when. So it's not only about the investment cost. You might don't have enough funds right now, but the transition is really mandatory for your clinic at this time, so it's your decision. So please, as a homework, you can just write down 3 points: why and what and when you need a digital transformation. So for me as a dentist, I need to know what are the advantages of implementing digital technology to my practice, and also for my patient. They will not come to my office just because I have the most advanced technology, but they will rush for sure to our office if you can share with them why you have this setup. And also for the lab technician, if they realize the advantages of digital technology, for sure they will invest. If we sort out the whys, we will see that we as a dentist and our lab technicians, our patient have the same answers. All of us, we are looking for better communication tool, and also we need to minimize the time, the number of visits. We need to minimize the cost, enhance the comfort of the patient, the simplicity of the procedures, give them a high quality long-term treatment. And for sure, after this pandemic, you need to add the safety. So what is the best machine in the market? Shall I invest in full solution or only digital scanners? First, you have to understand the digital workflow, and then you have to know what is your workflow and who will do the workflow. So you will do the workflow at your clinic, or you will send to your lab. And what if your lab is not ready yet? So what is the digital workflow? It's very easy, very simple. Scan, design, then produce. So you need an intraoral scanner, and that digital impression will be sent to your designing center in your clinic or in your lab to virtual fabricate your restoration. Then it should be forwarded to the production. Either it's a milling machine or a printing machine. So first of all, you need an intraoral scanner to get the digital impression, and according to what you will scan, you can now decide which scanner brand will suit your practice. Is it simple case or advanced? You will scan for a surgical guide, ortho, dentures, or prosto. Is it aesthetic case or full mouth rehabilitation? Then next, you need a designing software. But who will do the designing? Do you have time to do your own lab work? If not, do you have the budget to hire a lab technician in your office? Or do you need to outsource your scans? According to that, you can decide which is the best designing software suits your practice. And what about the production? Do you have a space to acquire a new machines in your clinic? If not, does my lab technician has digital solutions? What are my production type? It's very important. Then you can decide which machine is better for you. Is that digital scan is enough, or do you need to collect some more information to improve your designing and to be able to better communicate with your patient and your technician? You might need to add a camera to capture a 2D photos. Also, for some advanced cases, you might need to add a 3D face scan. And for most of our cases, we need a CBCT machine. So all depends on the quality you are looking for. At the end, you need more data for better communication. The aim of implementing digital technology in our practice is to minimize the unnecessary treatment and procedures. For instance, extraction just because you need to place an implant, or aggressive preparation just because we have one missing tooth and we need to place a bridge, and sometimes root canal treatment just because we need to do a crown. And to meet the patient expectation, we have first to listen to our patient, communicate with our patient, with our lab and colleagues, get a second consultation, plan the case, do some trials, then you can start your procedures. And from here it comes the idea of having the virtual patient in your PC, so you will be able to do simulation of real life clinical scenario for the purpose of developing clinical skills by making diagnosis, taking therapeutical decisions, practicing in safe environment, assess your treatment plan, treatment option, time and cost. So the first communication tool is the Digital Smile Design DSD with only two simple photos. Easy procedure, straightforward, it's not costly as well. You can start the initial communication with your patient, discuss what you can do for them, how to get the optimal results, and get the patient initial approval. So this is the very important step to get the patient initial approval. Later on, you can move to the second stage where you need to collect the patient data and build up your virtual patient. So here what you are doing, just we put the template, the design template, discuss with our patient, show him the different design, ask the patient to select between the designs, and also get the patient input. You can correct according to your patient smile, show them how it could be the final results, what we are able to do, like gingivectomy or crown lengthening or even reduction for some teeth to get better results. All these things you can discuss with your patient from first visit with no any extra cost. And once your patient you get the approval from your patient, then you can share this information with your patient, and also you can share it with your lab technician, so also your lab technician will be involved in this treatment plan. Then now you need to start build up your virtual patient, starting with the intraoral scan. So the nice things about intraoral scan, you are able to get a high accurate scan in very short time and very fast. So, and the nice thing here, you can add as well the patient specific movement to transfer the jaw motion to your virtual articulator, and you can build up your occlusion according to the patient parameters, not to preset parameters comes with the articulator. Then capture the face by 3D face scan. So it's a 3D virtual design, and also you can add the CBCT. So all this information can be integrated in the software utilizing the software tools, and then according to that you can start your virtual design. So now you have the face, you have the jaw motion, you have the CT, and the photos. You have all patient information ready in your desktop or on your PC. Once we are done with our design, now it's a time to have the physical production like models or temporaries, or even the final restoration, high quality biocompatible production, low cost and short time. So what kind of production? The digital production, we have two types of productions. Printing additive manufacturing is a process of making 3-dimensional solid object from a digital file. In additive process, an object is created by layering down layers of material from liquid resin until the object is created. Each of these layers can be seen as a thin sliced horizontal cross-section of eventual object. Produce a complex shape using less material. And on the opposite we have the subtractive manufacture, which is cutting out or hollowing out a piece of material like plastic or metals or zirconia or ceramic by a rotary cutters, and that rotary cutters will remove out all the excessive materials. So we are the digital generation where everything is single touch away from us. So it's very easy to connect with the whole universe in a simple way. In my opinion, in future, a digital designing center will be established. Actually, I already started. I have my own. The patients will come and their digital data will be collected like a 2D photos, intraoral scan, face scan, CBCT, and all this data, digital data, will be uploaded to something called like dental cloud, and which has pre-registered digital dentists, and the interested dentist can accept the case and send back to the designing center or the digital center or to the patient the treatment options, the material selection, the virtual final result design, and as well the estimated cost. So the patient now will have the option to select between dentists between dentists, and also as well the material, the location, according to the quality, not anymore according to social media. So take home message, you are in this digital era. So either you start, train yourself, enhance your knowledge, find the way to implement digital technology in your daily practice, attend some advanced digital courses, training, otherwise you will be left behind. So it's your choice. Thank you. I really appreciate your time. Please, if you have